This is Cheska Clea J. Ibanez. In this video, I am doing the nursing assessment of cranial nerve, the cranial nerve 1 to 12. So before we start, this is the things to do. Provide privacy to patient, perform hand hygiene, explain the procedure. Cranial nerve 1 or the olfactory.
Good day everyone, good day ma'am. Now we are going to have a cranial nerve test. We are going to test the olfactory or the cranial nerve 1, the sense of smell. Now I want you to take off your mask and close your eyes. And smell it and tell me what you smell.
Strawberry flavored perfume.
You have a excellent olfactory.
Cranial nerve 2 or the optic nerves.
Now, what I'm gonna have you to do is I'm gonna have you to cover your right eye, and I'm also gonna cover my left eye. So on the same side, then I want you to look at this eye, my uncovered eye, and don't look at my fingers. I want you to tell me if how many fingers you see. How many fingers you see? 2, 3. Opposite eye. 2, 3. So what we're gonna do is look at the chart over there and try to read the lowest line for me that you can read. And first, you're gonna cover your right eye, then your left eye, then we'll do both eyes. So cover your right eye. So what line can you read?
Line number 8.
Please read.
DEFPOTEC.
The other side.
DEFPOTEC.
And now read with both eyes.
DEFPOTEC.
Cranial nerve 3 or oculomotor.
Now we're going to assess the cranial nerve 3, which is the oculomotor, cranial nerve 4, the trochlear, and the cranial nerve 6, which is the abducens. And we're gonna do several tests to check their function. The first one that we're gonna do is we're going to be looking for any involuntary shaking of the eye called nystagmus. And how we're gonna do that is we're gonna take our pen light, we're gonna hold it about 12 to 14 inches away from the patient's nose, and then what I want you to do is to keep your head still and don't move your head, and just use your eyes to watch where I move the pen light. And as you're doing this, you're going to perform it in the 6 cardinal fields gaze. And you move it, you are looking for any involuntary shaking of the eyes. So, we'll start.
Cranial nerve 4 or trochlear. Cranial nerve 5, the abducens.
The next thing we're gonna do is we're gonna check for accommodation, and how we do that is we turn on the light back on. We just previously had them dim, but we now make it light again. We're gonna have her stare off at a distant object that helps relate pupils, and we're going to take a pen light. You can use a pen light finger, and you're gonna slowly move it inward to the nose. And what you looking for is what those pupils constrict, they accommodate, and they eyes closed while looking at the pen light. So here we go. Stare off in in the distant place, and I don't want you to move your head or anything. Just keep it real still and just follow this in light. So now we can document, because just check all the things with the eyes. We can document that the pupils are equal, round, reactive to light, and accommodate, so that where that acronym PERLA comes into.
Cranial nerve 5, the trigeminal nerve.
The next thing we're gonna do is the cranial nerve 5, or the trigeminal nerve. And this nerve is responsible for many things like massification. So what I'm gonna have you to do is I'm gonna have you to clench your teeth, like bite down, and I'm going to feel the masseter muscle. There should be a nice firm bolt, and then feel the temporal muscle. And now what I'm going to do is to test the nervous, have her to try to open her mouth against resistance.
Cranial nerve 7, the facial nerve check.
And while we're here, we're gonna go ahead and look at the facial expression and test the cranial nerve 7, which is the facial nerve. So can you close your eyes tightly? Open them up. Now smile for me. Frown and puff out your cheeks. So she did that. Excellent. So that cranial nerve is tired.
Cranial nerve 8, the vestibulocular.
Next, we're gonna test the cranial nerve 8, which is the vestibulocular nerve. So what I'm gonna do is I'm gonna include one of her ears and then whisper 2 words on the other side. She needs to tell me what I said. Now, we'll start.
Apple juice.
Other side.
Honey butter.
So, correct.
Cranial nerve 9, the glossopharyngeal.
The next one that we're gonna do is we're gonna assess cranial nerve 9, the glossopharyngeal. And so what I'm gonna do is I'm gonna have you to say ah, and what you want to is that uvula to move up, and then we're just gonna test the gag reflex. And I'm just gonna put a little bit back there and elicit a gag reply.
Cranial nerve 10, the vagus.
So the cranial nerve 10, the vagus, is intact because she's able to talk to me without harshness, and she's able to swallow.
Cranial nerve 11, the accessory nerve.
And what we're gonna do is we're gonna test the cranial nerve 11, which is the accessory nerve. So what I'm gonna have you to do is move your head side to side, up and down, then shrug. And try to shrug against my resistance. And she does that with ease so that the nerve is intact.
Cranial nerve 12, the hypoglossal nerve.
So the last we're gonna assess is the cranial nerve 12, which is the hypoglossal nerve. And what I'm gonna have you do is I'm gonna have you to stick out your tongue and maybe side to side, and she does that with ease. So this wraps up how to perform a nursing assessment of the cranial nerves. So this is Jessica Clea Ibanez from Nursing 1B. Thank you for watching.